Hi, I'm Vanessa Mantilia, physical therapy intern from RTR Medical Foundation in Tacloban City. For today's video, we're going to be talking about the 3 outcomes measure used for individual with spinal cord injury. These outcomes measure include the Action Research Arm Test, the Activity-Specific Balance Confidence Scale, and the Pen Spasm Frequency Scale. First on the list is the Action Research Arm Test. The Action Research Arm Test is a 19-item observational outcomes measure used to assess upper extremity performance in stroke recovery, brain injury, SCI, and in patients with multiple sclerosis. Items comprising these tests are categorized into 4 subscales: the grasp, grip, pinch, and gross movement. This is arranged in order of decreasing difficulty, with the most difficult task examined first, followed by the least difficult tasks. Lyle proposed that this ordering would improve efficiency of testing, as normal movement in the most difficult items would be indicative of successful performance on preceding items. Task performance is rated on a 4-point scale ranging from 0 to 3. Then, who are the intended population? This test has been standardized for individuals with stroke, brain injury, SCI, multiple sclerosis, and Parkinson's disease. These tests can be administered to individuals with 13 years of age and older. But how do we perform this test? The Action Research Arm Test assesses the patient's ability to handle and manipulate objects in different sizes, weight, and shape. These tests are grouped into 4 subtests: the grasp, grip, pinch, and gross movements. For the grasp subtest, the patient is asked to grasp object vertically placed and then release each object to the desired location. For the grip subtest, the patient is asked to pour water from one cup to the other, transfer 2 different size alloy tubes, and transfer washer. For the pinch subtest, the patient is asked to grab smaller objects like marble using the fingers and release to the desired location. Finally, for the gross movement subtest, the patient is asked to touch the back of their head, top of their head, and their mouth. The total score in the Action Research Arm Test ranges from 0 to 57, with the higher score indicating better performance. These standardized tests will help you analyze your patient's functional abilities, identify his or her needs, create individualized treatment plans, measure progress, and streamline documentation. Moving on to our second outcomes measure, the Pen Spasm Frequency Scale. This scale is a 2-component self-report outcomes measure that assesses patients' perception of spasticity frequency and severity following a spinal cord injury. For its scoring and interpretation, this scale is composed of 2 parts. The first part measures how often this muscle spasm occurs using this 5-point scale, and the second part is a 3-point scale assessing the severity of spasms. Now for the last outcomes measure, the Activity-Specific Balance Confidence Scale. This Activity-Specific Self-Report Balance Confidence Scale is a structured questionnaire that measures an individual's confidence during ambulatory activities without falling or experiencing a sense of unsteadiness. This scale consists of 16 questions, gauging the individual's confidence while doing the activities. Now for the intended population, this scale is reported to be an accurate measure to identify individuals with a fall risk in populations of stroke, MS, Parkinson's disease, SCI, vestibular disorders, in elderly, and in other neurological conditions that can affect balance. For the method of use, so this scale is a 16-item questionnaire where patients rate their confidence while doing activities. Scoring ranges from 0 to 100, 0 meaning there is no confidence, and 100 is full of confidence. This scale has the following 16 questions that require the patient to rate his or her confidence that he or she will not lose balance or become unsteady while performing the following activities. That's it for today's video. Thank you for watching.